Today, we are defying dietary norms with a functional nutritionist that believes in eating pizza. Sarah flips the script on SIBO treatment and talks to us on how we can use intuition and bio-individuality to heal gut dysbiosis.
Yes, exactly. And I really appreciated that Sarah was so relatable, reasonable, and refreshing in her approach to managing SIBO and other gut issues. She really prioritizes root cause and sustainable practices to get her clients back to feeling their best and eating their favorite foods, as you mentioned, Melissa, and all without adding to what is such a already overworked nervous system, which we see so often in this space. I really enjoyed this one. Let's get started. Hello and welcome to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown, here with my co-host, Melissa Gentile. Today, we have the pleasure of speaking with Sarah Kahn, a board-certified clinical and functional nutritionist based in New York City. Sarah is an expert in tackling chronic digestive conditions like SIBO, IBS, and acid reflux through a holistic and integrative approach that she not only preaches, but has lived through herself. After years of battling digestive issues and nutrient deficiencies, Sarah began to help others heal by addressing the root causes of their symptoms. Her approach goes beyond diet. It's comprehensive lifestyle adjustment that includes stress management, appropriate movement, and optimal sleep. Join us as Sarah shares her journey and the insights that have allowed her and many of her clients to enjoy life to the fullest, rediscovering the joy of foods they love and leading healthier and more vibrant lives. Hello, Sarah. Thank you so much for being with us here today.
Hi, Emmy. Hi, Melissa. Thanks for having me.
Sure. So I love your website, Sarah. And one of the things you mentioned in your bio is that after healing your gut, you cannot now enjoy and tolerate your favorite foods. Dark chocolate, pizza, guacamole, 3 of my favorites. And so I must ask, is this real deal pizza? Do you have an alternative recipe? I think the point here is to really get us back to, right, the real thing that we love and we know so well. So either way, what's your secret?
Yeah, I mean, I no longer have any food restrictions or food sensitivities. I can eat all the things. Real pizza, although I have to say my favorite is sourdough pizza. Real pizza, real chocolate, real guacamole, beans, lentils, garlic, onions, which were really the final frontier for me. I can eat all the things. There's not really anything that I restrict.
And gluten, wheat is not an issue for you?
Gluten, wheat, no, bring it all on.
Yeah.
Yeah.
I love kicking it off this way because I don't think we've really talked about how can we build tolerance, especially to dairy and gluten. So I'm excited to hear your approach there.
Yeah, we're always talking about how we can cut these foods out and different alternatives and etc. But I love the alternative approach here. So kind of backtracking a little bit, before you got to this place where you can enjoy all those foods now, like what was your journey like, or what were your symptoms like that prompted you to explore your own health issues more deeply? And was it really difficult to kind of recognize those symptoms? Because oftentimes I think different digestive symptoms can be normalized, dismissed, or sometimes people don't even know how much better they can feel until the healing is like already done. So what was that time like for you?
Yeah, well, this was a long time ago. So my journey started probably over 10, 12 years ago. And I was experiencing your typical IBS symptoms, bloating, gas, constipation, abdominal pain. At the same time, I had a lot of anxiety. And my journey is like a lot of our clients, where we've seen a few doctors and feeling like we've been dismissed, like, oh, it's just IBS, as if that is somehow a good thing. And certainly it's not a diseased organ. It's not celiac disease. It's not IBD. But I wasn't really given a solution. And at some point, one of the doctors had given me what is now considered an archaic version of a low FODMAP diet. And I worked with a registered dietitian to take it a bit further and really understand, what does this look like? What do I do? And it really helped a lot, even though this was like an old version. This was before the Monash app. This was like literally a list of, eat this, don't eat that. And it was at the same time, like it was helpful, but it was also kind of really upsetting because I was a vegetarian, and it's like, well, what are you going to eat if you're not eating beans and lentils and things like that, garlic and onions and guacamole and
Gosh, all the tasty
again,
things.
all the favorite foods. So it was like good news, this could help. Bad news, like now you can't eat your favorite foods. And at the time, I don't think there was a lot of discussion around different food reintroductions and things like that. So I felt kind of stuck. And my first career was in marketing, and I was sort of at a crossroads with my career, and I wanted to do something much more fulfilling at that same time. Like it was kind of this convergence of all these different things happening. I learned how much better I could feel by focusing on my diet. And I decided to go back to get my graduate degree. And I know that's a little extreme. Not everybody can go get a master's in nutrition to understand how to help themselves, but it became like my obsession. And so while I was in graduate school, that's when SIBO was starting to become more known, and SIBO breath testing became available to more and more practitioners. And my functional medicine doctor at the time had ordered a SIBO breath test, and sure enough, it was positive. And like so many of my clients, there was this sense of, oh, now I have answers. Now there's a path forward. The path isn't always straightforward or smooth, but at least there's a direction. And so I was treated with both antibiotics and a round of herbs. And while that helped my gas and bloating and constipation, as a result of taking these treatments, I like developed a whole new set of symptoms, reflux and LPR. And I thought, oh, well, this will go away when I stop taking the herbs. And it didn't. And that set me down another rabbit hole of, why do I even have reflux? No one knew what LPR was.
Can you tell Sarah, LPR? I'm not sure.
LPR is also called silent reflux. And I will totally butcher this name, but it's laryngopharyngeal reflux. But basically, it's when your upper esophageal sphincter is also loose, and the gas, or not the gas, but the acid and the pepsin escape your esophagus and get stuck in your throat. And it gets activated by acidic foods and even pepper. Like I couldn't even eat pepper for like months. And it was extremely annoying, very uncomfortable. And it was very hard to resolve. And again, new doctors, new questions, all of that to say that what you don't understand prompts you to do deep dives, and then you learn more. So eventually these things had resolved. And over time, I was able to tolerate more and more foods.
And there's so much that goes into root cause of SIBO, and I want to dive into that in a little bit, Sarah. But you also mentioned, which I really appreciate on your bio, that regular moderate exercise was a key to your healing. No more high-intensity spin class.
Yes, and that was appropriate for that time. I don't want to say like that's a forever situation, but a big part of my own healing is nervous system regulation. There was a lot of anxiety and overwhelm going on, and I had the SIBO, I had the reflux, I was in graduate school, like a lot of like, plus just being in New York City is overwhelming in and of itself. Yeah. So there's a lot of like nervous system stimulation. So I really had to like take a step back and be like, okay, what is up here? Why am I struggling with all of these symptoms? And even though the SIBO was much improved, now I'm dealing with reflux and LPR. They're all motility issues. They're all nervous system regulation issues. So I really had to sort of, take a deep dive into my own health and be like, okay, what's going on here? And so really focusing on, improving the parasympathetic response, dialing down, turning down the volume on the sympathetic response. And so, yeah, the HIT classes, they took a back seat for a while.
Sure. So it depends. There's a time and a place. Was there a practitioner who suggested that to you, or was it an intuition of yours that this was too much for that time?
It was just when you try, look, I mean, like everyone else, I want a quick fix. Like, I don't want to like have to do all the things to like heal. But when the quick fixes aren't working, that's a good time to step back and say, all right, let's look at the bigger picture here. And that is what prompted, like, okay, let's try some restorative yoga. Let's just focus on moderate exercise instead of increasing the volume and intensity on everything.
Right.
So it was more of an internal reflection.
Mm-hmm. And before we dive into your approach, Sarah, how do you suggest patients vet practitioners? You went through so much. What should they look for?
That's a really good question because we tend to see really complex clients who have been to numerous practitioners. And unfortunately, we have seen all the things you don't want in practitioners. So not to call out practitioners, we all want to help our clients feel better. I think it's important to understand what their approach is. Is it evidence-based? So that's number one. Is it slow and steady, or is it like hit like really intense? Are they meeting you where you are? We're very judicious about restrictive diets and using a lot of supplements. Both myself and the other practitioners in my practice, we're all really sensitive, delicate butterflies. So are our clients. And we realized that we don't need to be so heavy-handed with restrictive diets and a laundry list of supplements. And that just adds to that nervous system overload. And so, not to say that everybody needs to use our approach, but for our type of clients, this works out well because they've already seen other practitioners. In many cases, they've already seen other practitioners who may have put them on super restrictive diets, a laundry list of supplements, sometimes without monitoring, which I think is pretty egregious. And they're using cookie cutter protocols. And so I think it's really important to make sure that the practitioner is using, again, a judicious approach, but also a personalized, customized approach. Like what works for one client doesn't work for everybody. And I think that's important.
Yeah, we're all so different, have different histories, have different just emotional well-being is different person to person, health history is different person to person, nutritional status. So yeah, I definitely think a bio-individual approach is super important. And as you keep mentioning the nervous system, I can't help but think, isn't it so shocking and surprising that in some practices has become something we look at after we've tried all of these other things. And it's like, wait, that should really be kind of at the forefront of everything to begin with. I'm glad that practitioners like yourself are really bringing that to light. And I do kind of want to talk about a little bit the connection between gut health and psychological well-being, because I think that's a big topic that's being brought up as well. There's been a lot of discussion in the media about the impact of gut health on mental health. So I want to get your opinion on how can improving gut health potentially benefit our psychological well-being?
Sure. So we know that the gut and the brain are connected through the vagus nerve. We know a lot about how the microbiome is now impacting not just digestive health, but mental health and emotional health. And when you have gut issues, there could be not only microbiome disruption, but there could also be nutrient deficiencies, which directly impact mental health as well. We see a lot of mental health issues in our practice as well. So we see a lot of anxiety, overwhelm, depression, and that's not a coincidence. And interestingly, a lot of that can improve by having balanced meals. Serotonin is also made in the gut. And when we improve gut health, we could see improvements in mental health because of the improvements in serotonin production.
Hmm. That's so true about the comment you made about having balanced meals as well. Like I see kind of calling myself out here, iced coffee for breakfast and then wondering why you're feeling anxious in the afternoon. And it's like you didn't get any protein and amino acids and the fats that your brain needs and everything. So that's a really good point.
Yeah, absolutely. That's often the first thing that we're doing with our clients is understanding what are they eating now and where are the opportunities to just start with something simple. It's rather low-hanging fruit, but not to say it's easy to make changes to your diet, but just adding protein to meals and not skipping meals. I mean, that's a huge thing that we see, perhaps because there's so much discussion about intermittent fasting and different types of fasting. Meal spacing can be important, but skipping meals is it's going to make you feel pretty miserable, especially when you have digestive health issues.
Benefit versus risk, I think, in those cases with fasting, absolutely.
Mm-hmm.
Yeah. As you mentioned, also with high intensity exercise, time and a place. Got to get you there first, right? Yeah. I'd love to talk a little bit more about contributing factors, Sarah. You spoke on the migrating motor complex a little bit, but I don't think many realize contributing factors go beyond antibiotics, right? So we think about hypothyroidism, diabetes, Lyme disease, even food poisoning and traumatic brain injury have been linked to SIBO.
Mm-hmm.
And what I understand is that these all have in common disruption or compromise of the migrating motor complex. Can you speak to that mechanism a little bit for us so we can understand it a bit better?
Sure. So the migrating motor complex is the muscular action of the small intestine. It's like a cleansing wave. It's like moving things down and out, then into the colon. So as we touched on, SIBO is a motility issue, and where the migrating motor complex is compromised. And I like to think of SIBO as a symptom. And to your point, like what in the health history is really driving SIBO? What is impacting motility? And it could be something that you could have had an incidence of food poisoning like 10 years ago, and that could be impacting you today. So we really need to do a deep dive into the health histories to understand like what's really driving this. And we do see not just antibiotic use, which is more of a microbiome disruption, which could then lead to issues with the migrating motor complex. But I think the number one risk factor, at least in medical literature, is history of food poisoning, traveler's diarrhea, because you can develop, let's say, antibodies to these cells that are in the migrating motor complex. And it could last for years, but it does eventually recover. So this is not like a forever situation. And that's also in my own health history as well. So could that have been a factor? Absolutely. But we do see hypothyroidism. We see diabetes, prediabetes, blood sugar dysregulation can impact motility. We see also medications that can impact motility as well. So we really want to kind of get a 360-degree view of health history plus current history of what could be contributing. And it's often not just one thing. It's usually multiple things that are going on.
And Sarah, going off of that, I do have, when it comes to SIBO, I know that there's a lot of kind of opinions on treatment protocols, probiotics, antibiotics, and just different beliefs about the condition overall. So I do have some statements for you, and I want you to let me know if you agree, disagree, and then what your opinion is on it. So I know we mentioned FODMAP a little bit earlier, but let me know what you think. A low FODMAP diet is the most effective diet for managing SIBO long term.
I will disagree. Hopefully, you don't have to manage SIBO long term. A low FODMAP diet or a modified low FODMAP diet may be helpful at managing symptoms in the short term. But once you address SIBO and once you address the root cause, if that's even possible to address the root cause, not always possible, then hopefully you can broaden the diet and eventually bring back as many of the FODMAPs as possible. Now, with that being said, lactose intolerance and fructose intolerance is actually very common, even in people who don't have SIBO or IBS. So those things may need to be enjoyed in moderation. But our goal for our clients is for them to be on the broadest diet possible with the fewest symptoms.
And this next one kind of goes hand in hand. SIBO cannot be completely cured, but only managed.
I would say for most people, and again, it depends on their health history. For most people, SIBO can be resolved. I don't want to use the word cure because that kind of implies that it's a disease. It's not really a disease. It's a symptom. It's a type of dysbiosis. I don't want to minimize SIBO either because I know there's a lot of people who have it and that are feeling pretty miserable. But it's not a disease in my point of view. But can it be resolved? Absolutely. Again, it goes back to like what's driving it. What are the root causes? For some people, it might have to be managed because perhaps they have a condition that causes slow motility of the intestines, and that's just a part of their overall condition. But can their symptoms be improved? 100%.
And what about probiotics? Probiotics should always be considered as a part of a SIBO treatment plan. Do you agree or disagree?
I don't have strong feelings about probiotics one way or another. A lot of clients come to us having tried probiotics. So if they're coming to us, it didn't work for them. Not to say it doesn't work for them in the future, like there isn't a role for probiotics in the future. There's a lot in the medical literature that suggests that probiotics can actually be pretty helpful. So, you know what? It's a cheap and easy experiment. It's like you try it for a month, and I don't suggest trying just any probiotics, but there's certain probiotics in the medical literature like Saccharomyces boulardii, for instance. Try it, see how you feel. Give it a month. Do your symptoms improve? If yes, great. If no, stop. It doesn't have to be very absolute.
I like that idea of just kind of trying it out, see how you feel.
Yeah.
And just kind of
if it makes you feel worse, stop.
Kind of the same approach with fermented foods. I know some people
fermented foods.
Yeah.
Yeah, I mean, it's very similar. Again, some people come to us where they're feeling pretty sensitive to pretty much everything. And we see a lot of clients with some degree of histamine intolerance. So fermented foods aren't always going to be tolerated, especially in the midst of a lot of symptoms. However, when we're feeling better, part of our protocol is to eventually bring in some fermented foods if they can tolerate it. I mean, me personally, I've also went through a period of histamine intolerance, and now I enjoy fermented foods. That's part of my regular day-to-day diet. But it wasn't always the case. So there's really nothing I would take off the table as like a forever situation unless there's a really good reason to justify it, like an allergy or celiac disease, IBD, etc. But again, if there's something that you want to try, there's always a way for the most part.
And actually, you triggered a couple questions in myself about histamine. So if someone is having an issue with histamine, you might take out some of those really high histamine foods, like the fermented foods, alcohol, even some like vegetables, things like that. But how are you kind of addressing that so that they can tolerate histamine foods down the road? Is it more of like they just need to upregulate some of the enzymes to help break it down, or how does that really work?
So we often see histamine intolerance in our gut health clients for a number of reasons. They could have, just the gut health issues that of themselves may be driving histamine intolerance because there is an enzyme that's produced in the small intestine called DAO enzyme, and that helps to break down histamine in the gut. Their detoxification pathways may be compromised during this time as well. Stress and overwhelm contribute to histamine. So think of histamine as like a bucket, kind of like the same analogy with the FODMAPs too. It's like if you have a lot of FODMAPs or histamines in your bucket's going to overflow, especially if you add high histamine foods to the mix. For our clients who have a lot of environmental allergies, that fills their bucket up pretty high. And that's not necessarily related to SIBO, but that's just like an immune system consideration. So their bucket's pretty high. When we heal the gut, when we get further down the road of gut healing, they're able to produce their own DAO enzymes, or we may want to add a supplement to help support that. But we're kind of approaching it from multiple angles. We're trying to lower the load, but at the same time, give them support and perhaps some mast cell stabilizers. So quercetin, vitamin C, omega-3s, fatty acids, and we're trying to, again, be on the broadest diet possible. So even within that lower histamine umbrella, we're still trying to get all the good things that can help with detoxification, help with histamine metabolism, help support mast cells and stabilize them, which sounds like we're doing a lot of things, but a lot of that can be done with diet and some choice supplements.
Makes sense. And I can clearly see, as you say on your site, Sarah, that your plans are simple, doable, and effective. That's what I'm getting out of this. So hypothetically, let's say we have a client with a history of food poisoning and downstream SIBO. What's a typical plan for you for this client?
Well, as we're going to do a deep dive into their health history, their medications, their supplements, if they're taking a lot of supplements, we will likely put them on a supplement holiday.
Oh, yes. I
Maybe
love how
let's take a few weeks off. Let's take a few weeks off and let's see if what's helping, what's not helping. A lot of these clients are coming to us having been on the low FODMAP diet already or some restrictive diet. And the first things we are doing is we are improving digestive function. We want our clients to gently stimulate their own stomach acid, produce their own enzymes. We want to broaden the diet within whatever diet they're on. So if they're on a low FODMAP diet already and they're eating 10 foods, what 5 foods can we add to that just to get some variety going? But simple and effective things, for instance, can be chewing their food really, really well. In fact, when our clients sign up, they get things to work on before we even meet. Like a head start program. And chewing their food really well is one of these things. And when we get started, we hear all the time from clients who actually did it. I didn't think it was going to work, but oh my God, I feel so much better.
Oh, good.
So we get them to get started with really simple, doable, effective things. And that way we have the wiggle room to like bring in more foods. And we do that to help boost their confidence, to help with enjoyment, but also to help with digestive function. If they're not eating enough food or if they're not eating enough of the right foods, then they're just going to continue to feel pretty miserable. So we're not starting with restrictive diets. We're not starting with complicated fancy protocols. We're starting with the simple foundation that everyone needs to start out with. And we kind of correct for what they're doing and then see where we go from there.
Mm-hmm. And what about the effective part? Of course, we're going to look at clinical presentation as the most important piece here. But do you suggest repeat breath testing? Do you find that useful? Is that incentivizing and motivating to clients to see all of this work on paper, objectively speaking, with the data?
I think that really depends on the client. And we're not necessarily trying to go for, like, our goal is for them to feel better, not to have a negative SIBO breath test. So if they want the proof, great. But it's not necessarily something that we're recommending if they're feeling at least 75, 80% better. Then we can assume that it's been resolved. But I have a lot of A-type personalities that like data,
Of course.
and I can support that. However, if they're not feeling better, then we may want to consider retesting, like, is SIBO still there? Or do we want to pursue other types of tests or evaluations to understand, like, what else could be going on? And we see multiple other scenarios in addition to SIBO. Like, it's usually not just SIBO.
Can you speak to that a little bit more, Sarah? What other testing? Obviously, you may have your go-tos depending on the client, but what are your most ordered types of testing for these clients?
Yeah, so obviously they need to be evaluated by a gastroenterologist. So that's first and foremost. But let's assume that the endoscopy and the colonoscopy were negative. And if they have SIBO that's not resolving, or let's say they did a repeat breath test and it was negative, we would likely do a stool test to see, are we dealing with dysbiosis in the colon? So if there is dysbiosis in the small intestine, it makes sense that the same digestive dysfunction could lead to dysbiosis in the colon. We also see a lot of H. pylori. So that's an infection in the upper GI in the stomach. So we also see a lot of pancreatic enzyme insufficiency, fat in the stool, and candida. So those are kind of like the top things that we're seeing that could be standing in the way of resolving SIBO or contributing to symptoms if SIBO has technically cleared from a SIBO breath test, but they're still symptomatic.
And you mentioned earlier intermittent fasting, and it kind of sounded like possibly this wouldn't be the best tool for these types of patients, especially if they're wanting to keep their blood sugar regulated. They don't want to add more stress onto their nervous system. They want to stay in more of a calm state. But do you feel like intermittent fasting can still have its time and place when treating SIBO?
It's not something we recommend. I
Is that
mean, of course, there's like everything's case by case. If they come to us and they're like, hey, I'm not hungry for breakfast, I don't feel well when I eat breakfast, that's when we don't want to force people to eat when they're not hungry. But we're actually trying to get people to eat enough food and not skip meals and promote blood sugar regulation. And we also don't want to see grazing all day either. So we're trying to like come up with a happy medium. So meals spaced out every 3 to 4 hours, 5 hours possibly. If you need a snack, go for it. Like, this is not about restriction and deprivation. We don't want you to feel hungry. So the body likes routine. It likes regular meal times. It's also great for anxiety and mental health as well, that blood sugar stabilization. So we rarely would recommend, hey, let's try intermittent fasting when we're actually trying to get people to have a more regulated nervous system and regulated digestion.
I was just going to ask, how often do you recommend kind of between meals? But it sounds like that 3 to 4 hour window is kind of like that happy medium. What about eating before bed? Do you recommend
Mhm.
leaving a couple of hours? But I know that some people say that it can help them sleep, feel more calm, and just be in like a calmer state by having a little bit of carbohydrates in the evening. So what are your thoughts on that?
Yeah, that's totally case by case. If someone has reflux or someone is feeling pretty miserable, especially waking up at night or waking up in the morning and they're feeling kind of bloated, then we'll try to promote eating a little bit earlier before bed and maybe 3 to 4 hours before bed. But if somebody is having poor sleep or insomnia, then yes, we'll have them experiment with either having a little bit of carbohydrate, maybe 90 minutes, 60 minutes before bed, and then experiment with having a little bit of protein 60 to 90 minutes before bed and seeing how they feel. So there's no right or wrong, and everything is a science experiment, but there's a time and a place for late night eating.
We all like to hear that, I think.
And speaking
Sure.
of restrictive diets, I also found on your site you speak to the elemental diet and a possible side effect of candida. And I mean, and it's so extreme. I'd love to hear your thoughts on that. Do you ever implement the elemental diet, or is it totally a no go for you? Because we're talking about case by case, but that one is so extreme.
Yeah. Can I use expletives on this podcast?
We have heard it before.
I strongly feel negatively about the elemental diet for a number of reasons. Number one, we call it the nuclear option, and we will do everything and recommend anything else but the elemental diet. That being said, we've had clients come to us. Their practitioner had recommended the elemental diet, and they're like, "I've tried it myself, and now I feel miserable. Or can you help me get through it?" So we have escorted, accompanied clients along that journey, and yes, it needs to be accompanied with some type of antifungal to help prevent candida overgrowth. But in the experiences that I've seen, it's pretty darn miserable. In solidarity, I tasted it with a client and tried to come up with all different ways to make it taste better. It tastes pretty horrible. And to drink a chemical laden beverage pretty much all day in order to meet your calorie needs and to keep blood sugar steady. Literally, you're drinking this all day long and feeling miserable. Like it, and then for it to maybe work or not work, it's just, and at the end of the day, you're still not addressing like the reasons you have SIBO to begin with.
Good point. Yeah.
And in looking at the medical literature, there's one study on a very small group of people, and it was not clear that they even had SIBO to begin with. It was like done 20 years ago with diagnostic criteria that's very outdated. So I don't touch an elemental diet with a 10-foot pole.
That's very clear. Thank you for that. I appreciate that. And it's important because it is still part of this, as you said, cookie cutter kind of approach or as an option, but still in the algorithms that I'm seeing. I don't know
Sure.
about you, but I've seen it pretty recently as at least an option. So speaking of stressful therapies, let's talk about stress management. And I'd love to turn it around the focus and turn it out on you as far as working with these clients. That can be taxing. So how do you manage your own health and well-being considering the demands of this profession and these types of clients?
Yeah, I think especially because this podcast is geared for other health and wellness professionals, I think that's a really important subject to address is that no one really prepares you for the kind of energetic and emotional needs for these jobs. I don't want to call them jobs, but this career is extremely emotional and energetically, I don't want to say taxing, but it requires a lot. And it's easy to get overwhelmed in your client stories and wanting to help, everyone. And so focusing on your own stress and managing your own nervous system is really important, and your own nutrition. I also say that being a nutritionist has kind of ruined food for me in a way. Like, I used to cook and I used to spend a lot of time in the kitchen, and now I'm like, I am the laziest nutritionist you will ever know. Like, give me a box of salad and some eggs, and like, I also want to be in and out of the kitchen. I am not the nutritionist. It's like, oh, make your own homemade mineral broth and bone broth, and everything's homemade, and squeeze your own nut juice. Like, who has time for that shit? Nobody, not my clients. But anyway, but yes, taking care of yourself is extremely important. Exercise, being out in nature, spending time with loved ones, and doing what just turns your brain off for a while.
Yeah.
Laughing, traveling, but moving, being out in nature. We actually moved to the country recently, and there is nothing more relaxing than just going out for a walk and or a run or doing any type of movement outdoors. That is my way of decompressing.
I love how you take the stigma out of, and I hate to use the word shame because it sounds crazy, but the stigma or the shame out of this, we must be making everything from scratch. And like you said, this, who has the time, who has the bandwidth, I mean, we're working really hard all the time. And I think that it's very idealistic. And again, there's a time and a place, and it can be really wonderful if you're in the mood. And if you are not in the mood, then there's no shame in that. And it's still about getting the nutrients in and doing what makes you feel good. And that might just be getting outside, like you said, not making your own nut milk. So thank you for that.
I mean, not to take away from people who enjoy that as a form of self-care. That's not my idea of self-care. But we also try to do that for our clients. Is like it's hard enough to try to minimize processed foods and going out, and our clients are working full time. They have families. They're trying to navigate the world just like the rest of us. It's overwhelming. So changing your diet is going to be stressful. It's another layer of overwhelm on top of it. So we're giving them permission to make it as easy as possible. So if whatever that looks like, I'm all for it. In fact, I'll help you figure out some high quality, quick resources. So if that's meal delivery, if that's buying pre-chopped veggies, if you're just to get them in, great. If that's using pre-made spice mixes or whatever that looks like for them, like, I'm here for it. And whatever helps them meet their goals, we just want to do it in a quick, easy, it's not quick and easy, but a quicker and easier way of implementing.
Sure. Very realistic approach that I appreciate.
Yeah.
And making it as sustainable as possible. Because like you said, if we're making everything from scratch, everything's homemade and putting all this pressure, I mean, you might be able to maintain that for a short amount of time, but you can't do that forever. So I really like the kind of lifestyle approach that you have. And really this whole episode has just been filled with so much about the treatment of SIBO, but not making it overwhelming and thinking that there's harsh lines, black and white, yes and no. It's a lot of let's just kind of test this. Let's see how you feel. Let's focus more on how you're feeling and improving your overall health instead of just test results and just diets and elemental and et cetera. So I really enjoy your approach, Sarah. I think our audience is going to take a lot out of this episode. And I do like to end every episode on a really positive note and ask all of our providers, what does it mean to you to live a vibrant life?
That's a good question. Just bringing it back to our clients, they feel overwhelmed, they feel restricted, they can no longer enjoy the things that they used to enjoy, whether it's food, holidays, socializing, traveling, spending time with their kids and loved ones. So, that was also a problem for me a number of years ago as well. It's like I had to analyze menus before I went out to dinner. I was the one bringing my own food to social events and holidays. Traveling, I had to bring like my stash of supplements to make sure I was pooping and not feeling bloated and miserable, and micromanaging every little of food that went into my body. Like, that's overwhelming. And I'm happy to say that it's behind me. And it's such a contrast. It's like, hey, I can go to whatever restaurant I want. Holidays, I bring my own food because I'm here to share with everybody else, not because I have to. And traveling, like, we can go anywhere. We can do anything. We can eat anywhere we want. And just having that sort of bandwidth, at least sort of lifted, where I can focus and obsess on different things.
Having that sense of freedom to kind of show up and whatever you want.
Freedom, and then, finding it again and being able to make decisions and choices that have nothing to do with food.
Absolutely. And where can our listeners find you if they want to connect with you, work with you, or just learn more about your work?
Sure. So they can find me and my other amazing practitioners in our practice at bellyblissnutrition.com.
Awesome. And to anyone tuning in today, we'll make sure that we link this down in the show notes so that you can find Sarah, learn from her, connect with her, or even potentially become a client of hers. And Sarah, again, thank you so much for all of your insights today, for taking the time to be on our podcast and just leave us with so much more information and kind of a new perspective on treating SIBO. I really enjoyed today's episode. I know our listeners will too. And until next week, wishing you all vibrant health and wellness.
Thanks for having me.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.